Hip replacement is major surgery, pretty scary, and nobody wants that. Normal people, so to speak, put it off as long as they can, put up with the pain, the immobility. I know that I did. Then it was over, it worked beautifully, and I learned a bunch of lessons. So here they are. This is a very dry and no fun at all video. So here's a look at the contents so you can skip ahead if you like. The symptoms are pretty significant. I mean, what brings you to this video in the first place? Preparation is absolutely everything. You really need to get that right. Surgery day, operating room, and recovery tell you how it will go in the hospital. I had a really nasty surprise. You should go see what it was. The lessons learned on the scar, silicone tape, and massage are pretty interesting. Techniques is a discussion on the 3 different ways surgeons can perform this surgery. And then we wrap up with long-term recovery stuff like the physical therapy you'll go through and how do you park. So, symptoms. Just what the heck is wrong? Well, the symptom primarily is pain. You can see in these x-rays that the ball and socket there on the right side has decent spacing between them. That's the cartilage. If you get over here to the left side, you can see that there's really nothing left. I had these x-rays taken because I was feeling dull, not throbbing, but dull pain, basically in the crease between the thigh and the torso. And you can see from the x-rays that that's exactly where the hip joint is. Besides revealing that there was basically no cartilage left there on the left side, you can also see those white streaks around the joint itself. That's arthritis. So, like pretty much everybody else, I went to an orthopedic surgeon. He explained what was going on. I said, I don't want surgery. And he said, well, you can try steroid shots. So, a steroid shot just basically dumped some steroids into the capsule around the joint, which calms everything down. Worked great until it didn't. So, again, pretty much like everybody else, I did that for about 8 months, finally gave up and scheduled surgery. I'm in my early 60s, in good health, and in decent shape. So I researched how the surgery would go, what would make it better, what would make it worse, and here are some lessons learned on the prep. First of all, the better condition you're in, the better it's going to go. If you have additional complications, especially severe morbid obesity, it's not going to go well. Along with doing whatever you can to reduce those other complications, you need to get your core muscles in really good shape because they're going to tie everything together while your hip heals. Your core muscles are essentially those between your knees and your ribs. I go to this all-purpose gym, which has machines like this that are really good at working out the core. Every other day, I'd go to this gym, and on one day, I would go just down the line of machines that are set up to work everything. And on the next visit, I would use the machines that are specifically designed for the core, which in this case are in a room by themselves. This one works the lower back. I do it by leaning over the top as it's designed, picking up a 25-pound weight, and slowly doing the back exercises with the weight. This one works the abdominal muscles in the front by grabbing those handles at the top, locking your elbows into the pads right below the handles, and slowly using your knees and abs to move those weights forward, pause for a second, and let them slowly back down. These two work the hips themselves. The one on the left has you squeezing the pads together, working the inner parts. The other machine toward the right has you spreading your knees apart to work the outside of the hips. This one works the torso by kneeling on that swiveling pad there in the center, grabbing those 2 bars and twisting your torso against the weight. Regardless of where you go, you will find a helpful staff. Find them, explain what you need, and they'll design a program for you, something like this. Because you're not going to be able to do a lot of aerobic exercise for a couple of weeks after the surgery, I also strongly suggest that on the alternating days you do something aerobic like a stair stepper, walking, biking, something to get, again, your body prepped for what's coming. And then there's the surgery day. Yuck. I strongly suggest that you take the earliest possible time on that day that you can get. Going first, like I did, has everybody nice and fresh, and there's more time for anything that you need to do in recovery, or even in some cases, this can be outpatient surgery, so you have a little more time in recovery before you go home. A bit of a trigger warning, the next two photos have, well, a leftover body part. As for the day itself, you show up, you fill out some paperwork, you get into that very stylish hospital gown thingy, an IV is started, and you get wheeled into the room. You can, if you want, look at the very nice attendant there, ask what they're doing as they inject some stuff into the IV, and the next thing you know is you wake up in recovery. I asked the surgeon to take up a couple of photos for me, and here's what I got. This photo shows mainly the surgery tools, spreaders, and a hammer. The new joint comes in two pieces. One replaces the head off the top of your leg bone, which has to be cut off. There it is on the table. To replace that, the surgeon will drill a long hole lengthwise into the bone and hammer in the replacement part that holds the new ball. The other side of this new joint is the plastic cup that the replacement ball fits into. That's made by reaming out the bone on the torso side of the hip and embedding the new cup into that spot. This close-up shows that old ball really chewed up, and you can imagine how much pain that can cause. This gives you a pretty harsh illustration of what's going on in your joint when the x-ray shows that there's no cartilage left. In my case, I stayed in the hospital for a night for observation. Because my prep, that physical stuff, had gone really well, this was no big deal. In fact, the worst hassle was being woken up every other hour so that vital signs could be entered into my record. Next morning, occupational therapy folks and physical therapy folks visited to make sure that I was ready to leave. Because I had prepped the core muscles, I was easily able to stand up, walk around, use the bathroom, all the normal occupational therapy stuff that they had to see to certify my departure. The physical therapy folks introduced me to really simple exercises. Those exercises were much less strenuous than the preparation and were very easy. Now we get to the surprise and some, I think, pretty important lessons learned. I had heard the horror stories, even from a family member, about hip surgery leaving legs of different lengths, which really complicates life. So I was very sensitive to how this was going to turn out. When I got home and stood very straight with my knees locked, the legs were really different. I thought things had gone horribly wrong and obviously brought that up with the surgeon at the follow-up. He explained that the muscles around the hips and pelvis had done their best to compensate for the loss of cartilage in the hip and the pain. Therefore, the muscles were, let's say, pretty screwed up and keeping the legs from feeling like they were the same length, even though the x-rays during the surgery and afterward proved that they were. The combination of time and stretching pretty rapidly brought the legs back together. At first, the heels looked like they were both firmly on the ground, but sure didn't feel that way. After about 2 weeks, everything was back to normal, both in the way it looked and the way everything felt. Now to the lessons learned about the scar. Another trigger warning, scar photos coming up, and they're not pretty. My research indicated there's two things you can do to minimize a large scar. You can cover it with silicone, which seems to help, and you can also massage the scar to break up scar tissue and have it flatten out rather than end up permanently lumpy. This is the scar immediately after surgery, still in the hospital, and before a long-term bandage goes on. You can maybe see the stitches, and they're underneath a mesh glued on top again to hold everything together. That's covered by what is essentially a $100 bandage because it's really tough and sticks really well. You can go to the shower and this thing stays on for a few days. When all of that comes off, you are then on your own as to what you do with the scar. I started by applying silicone strips you can buy in a drugstore that are specifically made for reducing scars. Despite what the packaging claims, these things don't stick well enough, and even if they did work for the silicone, they just won't stay on. I then looked around some more and discovered silicone tape. This stuff has two advantages. It can be cut to whatever length you need, and it sticks really well. Here it is. All this time, I also gently massaged the scar to again break up the tissue before it forms permanent lumps, and did that pretty much whenever I thought about it, many times a day. These last photos show how the scar changed over time. Here it is just before these stitches came out, and while it looks much better, it's still pretty lumpy because of the stitches. Here it is just after the stitches came out, and you can already see that it's starting to smooth. Remember, I'm still using the silicone tape, and I'm still massaging the scar, although maybe only 4 times a day. A month after the stitches came out, the scar really is pretty smooth to the touch, although it's obviously long and visible. I stopped using the silicone tape at about a month and a half or so. You then fast forward 3 more months, and here you go. The scar is still a little bit raised relative to the skin around it, but you can see that it's much smaller and less visible. So that's it. Here are some final thoughts. You'll have to decide which of the 3 possible techniques you want for your surgery. Making that decision will also then focus your decision on which surgeon to use, because each one specializes in one of the 3 techniques. The surgeon can approach the joint from the front, from the side, or from the rear. The rear or posterior approach is the oldest one. My research showed that approaching from the front has become sort of trendy, if you will, but I didn't like it for a couple of reasons. That front approach has to work around some very serious nerves and also has to cut a blood vessel that has to be reconnected, and also opens up the capsule in a way that's not repaired. For those and a couple other reasons, I chose the rear or posterior approach, and it worked out great. You may hear claims that the posterior approach is bad because it cuts major muscles. That is no longer true. If a surgeon tells you that he has to cut major muscles from that approach, find a different surgeon. This surgery is a really big deal. You need to research the surgeon. I suggest you find someone who specializes in hips and doesn't also do shoulders and hands or all kinds of other stuff. I will reiterate the part about working out hard before your surgery to improve your core muscles and your other issues as much as you can. To that, I will add that you have to very faithfully and with lots of effort do the physical therapy after your surgery. Having your therapist work you really hard is a compliment. That's what you're looking for. You can also get back into the gym pretty quickly in, 5 or 6 days, actually. So clear that with your surgeon and your physical therapist, and then do that too. My surgeon wanted me using a walker for 2 weeks after the surgery, so I went to one of the secondhand thrift stores and bought one. It turned out that I was so strong that the walker really wasn't useful. It's primarily a safety device so you don't fall. The stronger you are, the less you need it. I did use a cane primarily for safety for about 3 weeks or so, although even halfway through I was pretty much just carrying it around. A handicap sticker for your car is quite useful for the first, 3 or 4 weeks. So work with your surgeon, get a temporary tag, and use that. So there you go. I hear that hip surgery, this replacement, has the highest satisfaction rate of any major surgery, and I believe it. These days, it is quite literally normal for me to step out of, say, the shower and see my hip in the mirror and go, whoa, there's a scar over there. I have literally forgotten that I had the surgery until I'm reminded by the scar. So good luck. I hope your surgery goes very, very well.